begun to focus on the early stages of the disease. So by focusing on those, I believe we can use something akin to a fulcrum approach. We can modify the disease by catching it at its earlier points.
And more information from you. You have a website?
Well, the Fisher Foundation has a website, www.alzinfo.org.
Dr. Barry Reisberg, thank you very much for sharing your insight with us.
Thank you. Good to be here.
When we come back, we'll focus on cancer and where we stand in the war against that disease. We'll be right back.
And it's been, there's basically three things that
Cancer. The very word strikes fear in the minds of people everywhere. Once, the C word was considered synonymous with almost certain death. But through years of medical advances, that is no longer the case. Survival rates for people with cancer have been steadily rising over recent years. There have been numerous medical breakthroughs for the treatment and cure of many cancers. Early detection, of course, is a key. To help us learn more about where we stand in the war against this dreaded disease, we're pleased to welcome Peter Slocum. He is the Vice President of Advocacy for the American Cancer Society here in New York. Thanks for coming in.
Delighted to be here. Thank you very much.
Where do we stand at this moment in the efforts to find a cure for cancer?
We stand at a point where we've made enormous progress in the last 20 years. If you talk to physicians who started their careers back in the 50s and 60s, they confirm what you said. They would go in and see patients, and it was always a fatal disease. That's no longer the case. Breast cancer cases, for instance, 90% survival rate if caught early. So that's extraordinary progress, and it's a combination of things. You mentioned early detection, absolutely vital. The advances in treatments, in the development of new drugs has been extraordinary. Drugs like tamoxifen and Gleevec for breast cancer have greatly extended people's lives, no longer a death sentence. And the other thing is prevention. We've learned an awful lot more about how to prevent cancers. Best example is probably lung cancer, where the curve of new cases is just plummeting as the smoking rates go down.
Now, you've also developed, is there a vaccine that has been developed for some cancers, cervical cancer?
That's right. It's the HPV vaccine, which prevents a vast number of the cervical cancers, which is going to be very important going forward because not just here, but around the world, cervical cancer is a hugely fatal disease, particularly in the third world countries. But in parts of this country, we have a lot of immigrants coming here who have not had good health care back home, and here they need that vaccine.
So many advances have been made, but why is it, if so many decades of this dreaded disease, the numbers, of course, are going down, the mortality rate reduced, but the survival rate has increased. Why can't we once and for all find a cure for this thing? We could put a man on the moon, but we can't find a cure for cancer.
Right. Well, cancer is many different diseases. The breast cancer genetic makeup and progression through the disease state is quite different from colon cancer. And we need to learn more about the genetic triggers that turn those cells on and off. And we're making progress, but we're not there yet. And different cells are turned on in different ways. So the scientists really have to be able to figure out what kind of protein changes are going to affect the breast cancer cells versus the colon cancer cells and the prostate cells.
The question that so often is asked about the genetic factor, as I asked with Alzheimer's, if your parents had it, does it mean that you're expected to get it as well?
In some cancer cases, that's true. The BRCA1 and BRCA2 well-publicized breast cancer risk factors does seem to have a pretty clear relationship, and there's a family cluster often with women who have that disease, but that's only 5 to 10% of breast cancers in our country, so it's a relatively small factor. It does not seem to be as strong a factor as we one time thought.
Now, you've already published extensively about the link between smoking and cancer, obesity and cancer, and what is the impact of this had?
Well, it's really interesting because the knowledge about smoking and cancer came in part out of a more than million-person study that the Cancer Society helped to launch with just regular folks signing up to have themselves tracked over time. And we learned a lot about those links between smoking and cancer, but it wasn't until we started passing laws like the no smoking in bars and restaurants and workplaces here in New York and the higher cigarette taxes that you really start to see those smoking rates plummet. And we've gone now down by over 20% smoking rates from the 90s to now here in New York and in many places around the country, thanks to those interventions, raising the price, limiting the places where people can smoke, and running TV ads persuading people not to start.
And obesity as well.
And obesity as well. We're not as far along in terms of preventing people from getting obesity-related cancers because the science is not as well understood. People haven't adapted to that fact of life.
What else is there new? What's new on the horizon? What can we expect? What should people know? That's the folks out there, lots of questions.
Well, I think one very important result of the health care bill that was signed, the Affordable Care Act, is that we're going to be able to make sure that people who have a pre-existing condition, your mother diagnosed with breast cancer, would no longer be excluded from getting insurance under this law, and no longer any lifetime caps or annual caps on insurance coverage. Used to be, and it still is, for the next couple of years, that if a woman is in the middle of chemotherapy treatment for breast cancer, she could run out of her insurance in the middle of treatment, and that's not going to be true anymore. So we expect we're going to be able to save millions more lives over the next decade thanks to that law.
Recently, I read of a study that showed that poverty plays a role in cancer deaths.
It does indeed, because lower socioeconomic communities in our society have higher smoking rates, higher obesity rates, and they're not connected with the medical systems. They don't have a primary care doctor, so they don't go and get screened on time the way you and I may do it, because we know we have insurance coverage and we can get paid for that screening and any treatment if we're diagnosed with something.
So you have some advances. Where do you feel you're faced with the greatest challenge right now? In what area?
Well, I sort of divide this whole cancer quest into what we do know and what we don't know. And
so let's take the two columns.
Okay,
what
so
do you know?
We talked about the prevention. We talked about the treatment advances that we've made. What we don't know is why do some cancers grow faster than others? And for instance, in breast cancer, we can do the mammography and find cancers at an incredibly small level, just 2 centimeters or less, but we don't always know which ones of those are going to grow and become dangerous in the near term. Same with prostate cancer. We can determine the PSA levels, which indicates a likely prostate cancer, but we don't know which ones can be safely left alone, watch the levels every couple of years, and which ones are likely to become fatal in the very near term. So that's a real big problem.
With prostate cancer, there's a lot of controversy over PSAs,
right,
whether they are a good barometer, whether the accuracy is telltale enough whether someone has cancer.
Right. That's still a concern because, as I said before, we don't know enough about the relationship between that PSA score and the likelihood that a prostate cancer is going to develop. Most of us, men in their middle age, are going to have some signs of prostate cancer before we die. Whether that kills us or something else is the question. We think that people ought to be checked for those PSA levels only in consultation with their physician to make sure they're tracking other things to see if that's really relevant to their health.
Other forms of cancer that still have stymied the researchers, that still there's no advancement, what are those areas that you're working on?
Lung cancer treatment is a real problem. We have, as I say, good prevention methods. We can encourage people to stop smoking, but 15% of lung cancers are not related to smoking at all, and we don't know enough about ways to prevent those and to diagnose them early. Lung cancer, unfortunately, is a much more fatal disease than breast cancer and prostate cancer or colon cancer because it's often not caught in time and people die much more frequently of that.
So frequently we hear people asking the question, we put so much money into an effort in the war in Iraq and Afghanistan, trillions and trillions of dollars, and they ask, well, what if we put that money towards cancer research? Would that hasten finding a cure for cancer once and for all?
I don't think there's any doubt that a significant increase in research funding would make a significant difference, would advance our success in curing some of these cancers. There's not an exact relationship between dollars and results yet, but we do know that there have been huge advances with the increased funding. In the 1990s, the NIH budget was doubled, and we'd like to see the same kind of commitment again now in the next decade, and we think we could make a huge increase.
So a lot of the federal grants that have gone towards cancer research have been cut severely?
That's right, and there are tons, not a very accurate word, but hundreds of well-qualified research proposals that have been approved by screening panels say this research should be done, it's promising, and there's not enough money to fund it.
So as we leave in the final few moments, folks out there who have so many things, questions in their mind, what information would you leave with them as far as the advances where we stand in the battle against cancer?
There's a tremendous amount of hope, tremendous success already, and I think we're on the verge of enormous progress in the next few years, and we could probably prevent, as a society, something like 60% of all cancer deaths today if we could stop everybody from smoking and get everybody physically active and at a good, healthy weight. And right there, we can make enormous gains.
People want more information, you have a website?
Cancer.org. Lots of information for people with cancer, families looking for treatment ideas and options. Connect with support groups. Give us a call. Give us a website.
Peter Slocum of the American Cancer Society, thank you so much for